Welcome to the deep dive. Today, we're really digging into how certain medications work inside the body, specifically right down in the bone marrow. We're focusing on a question that comes up a lot with treatments like BTK inhibitors, especially for things like Waldenstrom macroglobulinemia. The big question is, do these drugs, directly kill the cancerous cells there in the bone marrow?
That really is a key question. And well, the answer isn't exactly straightforward. It's sort of a yes, but situation. It's more like, yes, they do, but it often takes quite a while. And that part, the time it takes, that often surprises people when they look at the early results.
Right. Yes, but it takes a while. So it's not like an immediate wipeout of those cells, even though the patient might feel better quickly. That seems, well, counterintuitive, doesn't it?
Yeah.
Makes you really want to understand what's actually happening under the hood beyond just the initial numbers.
Okay, let's unpack this because it sounds like there's a really interesting mechanism at play here. So let's start with what you actually see happening early on in treatment. You mentioned patients feel better quickly? Oh, absolutely. When patients start on BTK inhibitors, the improvements can be quite rapid and significant, very noticeable. We see concrete changes. For instance, someone might have a really high IgM level, say 5,000, and within just maybe 2 months, that IgM, which, is abnormal protein, we track it, can plummet down to 1,000. That's a huge drop.
Wow. Yeah.
And we also often see hemoglobin levels start to normalize pretty quickly, too. That makes a massive difference in how someone feels, their energy levels.
Okay, so you got IgM crashing down, hemoglobin coming up, patients feeling better. So the natural thought process, I guess, is, well, the treatment must be killing off a lot of the cancer cells in the bone marrow to cause that, right? You'd assume maybe that if your IgM drops that much, your bone marrow disease, say it was 80%, should drop too, maybe down to 20% or something similar to match the benefit.
That's exactly the assumption most people make. It seems logical. But interestingly, from the clinical trials, we have not seen that, not that immediate proportional drop in the bone marrow itself. Even a month or two into treatment, despite those really positive changes in IgM and hemoglobin, the actual amount of disease in the bone marrow, it can look pretty much the same as it did before they started.
Still the same, even with hemoglobin back to normal and IgM way down.
Yes, it can be. Which, of course, leads to the question, well, what's actually going on then? What does this all mean?
Right, that's the million-dollar question. If the cells aren't dying off in proportion to the symptom improvement, how are those improvements happening so fast?
Yeah.
This is where it gets really interesting, I imagine.
Exactly. And the core mechanism, at least initially, isn't primarily about killing the cells outright. It's about inactivating them. That's the key word here. Inactivation, not immediate cell death on a mass scale.
Inactivation. Okay.
Yeah.
So what does that do?
Well, it has this really crucial dual impact. First, when you inactivate those malignant Waldenstrom cells, their main job, producing that IgM protein, that production it drops rapidly. So that directly explains why the IgM levels fall so quickly.
Oh, okay. So you shut down the IgM factory, basically.
Pretty much. And second, those malignant cells, they don't just make IgM. They also have this kind of suppressive effect on the healthy bone marrow cells around them. A bad influence, you could say. So when you inactivate the malignant cells, you remove that bad influence. You lift that inhibition off the good cells.
And the good cells.
The good cells, the healthy bone marrow, they sort of wake up, they reactivate, they start doing their job again, like producing red blood cells, which means hemoglobin levels go up. They start making hemoglobin the way they're supposed to, sometimes even better than before.
Okay, wow. So putting it together, inactivating the bad cells stops the flood of IgM and frees up the good cells to make hemoglobin again. That perfectly explains the fast IgM drop and the fast hemoglobin recovery. But, and this is the fascinating part you highlighted, this isn't necessarily reflecting that the same proportion of cancer cells have died off in the marrow yet. They've just been quieted.
Precisely. They're inactivated, their negative effects are reduced, but many are still physically present, at least early on.
So what happens to them long term? Do they eventually die?
Yes, they do. That's the other crucial part of the story. While the initial big splash is inactivation, the cells do die over time. It's just not immediate. When we look at the long-term studies following patients for years, we do consistently see a gradual decrease in the bone marrow disease burden. So that percentage of disease in the marrow does go down, but it happens, throughout the years of treatment.
Got it. So it's definitely not that instant proportional kill like we might have assumed. It's a slower, steadier decline in the actual cancer cell numbers over the long haul. So what does this all mean for you listening in? I think it really highlights that understanding the how and the when of a treatment is just as vital as knowing that it works. You have to look beyond those initial, sometimes dramatic results to grasp the full picture. So just to recap this deep dive, those rapid improvements you might see with BTK inhibitors, the falling IgM, the rising hemoglobin that's initially driven by inactivating the cancer cells. This stops their bad effects, like making too much IgM, and it lets your healthy bone marrow get back to work. But the actual reduction in the number of cancer cells in the bone marrow, that's a more gradual process that happens over the longer term, over months and years, as those inactivated cells eventually die off.
Exactly. And it really brings up, I think, a broader point to consider. When you encounter any new information, whether it's about a medical treatment, a scientific finding, anything really, how much do you tend to dig past those first, maybe really striking headline results? How much do you push to understand the mechanisms underneath, the full timeline, the deeper story, something to think about, perhaps, how that deeper look might change your perspective?